All right, so here we are looking inside Lee's knee. This is the inside half of the knee, what we call the medial side of the knee. And we've stopped it here to give you an idea, and I think we've got this on the telestrator here now too. So this is a loose or torn piece of articular cartilage that's freely floating around inside the knee. And Lee had a variety of things that were wrong with the cartilage inside of the knee. And when they tore, he kicked out a bunch of these loose pieces of cartilage. And we found probably a dozen of these pieces free floating around inside the knee. Now this one in particular looked to me like it had come from the articular cartilage of the medial femoral condyle. You can see there's a little bit of a hole back there that kind of matches up with this piece, and that's probably where that came from. We can see in this clip the torn medial meniscus. So again, we're on the inside half or the medial side of the knee. This is the surface of the medial femoral condyle, or the femur, the thigh bone, as it comes down and forms the top of the knee joint. On the bottom here is the medial tibial plateau, and that's the top of the tibia or the leg bone. So it's right where these two bones meet. That's where the hinge happens in the knee. And in that area is the medial meniscus. And this is the inner edge of that medial meniscus here. And then this thing's got a big tear in it that goes up like that. And then this is all kind of shredded up in here. This is a complex tear of the medial meniscus. And you know, the reason this hurts is that these pieces that are torn and loose and moving around in here get caught between the two bones, the femur on the top and the tibia on the bottom. And the tolerances inside this knee are such that if you get a loose piece caught between those two bones, it's like somebody stuck you with an ice pick. It doesn't feel good at all.
Right. Now, I mean, and the whole point is that you've got this set so that it's pulled apart, but when he's walking, they're smushed together.
That's exactly
right. So we're
right.
looking at an artificial space that doesn't
normally
usually
does not exist. Normally those surfaces are right up against each other. Now this is his ACL right here, Rick. So on this photograph, we're kind of in what we call the notch region. The femur's got this notch in the middle of it where the cruciate ligaments attach, and then the tibia is down here on the bottom. And right here in the center, you're looking at his ACL. There's one edge of it, here's the other edge of it. You can see there's a big blood vessel running down through it there.
Oh, okay.
And you know, we're all aware of these torn ACLs in athletes, but this is an absolutely perfectly normal looking ACL right there.
Where does it tear usually?
Typically in the top half. Usually when we go in, and I just did 2 ACL reconstructions today, the bottom half is almost always well preserved. It tears up in the top half here. It can either tear in the substance or it can tear right off of the femur, right up in there.
And right now, how are we fixing those with your own tendons?
Yeah, so there are a lot of different things you can use to make a new ACL. My preference after 25 years of doing this is the middle third of the patellar tendon that we get from the patient, not out of the bone bank. Now we're over on the lateral side. This is the outside half of the knee, and I include this mainly to show you what a normal meniscus looks like. And it's not completely normal. You can see that the inner edge of this thing is frayed a little bit in here, but this back third of the meniscus looks very different from his medial meniscus, whereas the medial meniscus had that big tear that was going up like this and it was badly frayed up in here. This lateral meniscus really looks pretty good. So now we've gone through, we've done our full diagnostic arthroscopy. Now it's time to start doing a little work to help out Lee. And this tool that you see me using here is a motorized shaver. It's about 1/6 of an inch in diameter. It's got a rotating blade and it's attached to suction. And you can see it does a beautiful job of cleaning up that medial femoral condyle where that tear had occurred and that loose piece had gotten shot out into the knee. So now we're going to go back and start cleaning up that torn medial meniscus. I'm going to use the shaver to start with here. You can see it pull in that torn and loose piece and it'll start chewing it away. And all the loose pieces of that then are sucked out or extracted from the joint. So we'll use the shaver to get as much of that material out that's torn as we can. We always, of course, want to leave as much of the healthy tissue in as possible. Finally, we're going to do a little cleanup here with a little punch biter that I've got here. So some of that tissue I can't get off with the shaver, and we have the series of different little punch biters that we can just trim off the torn pieces. And you can see this thing does a nice job of just taking off the torn stuff, getting back to the good, healthy cartilage back there. So on the right side here, we've got the after, and on the left is the before. So you can see the tear in the medial meniscus, the loose piece, the frayed pieces back here, the rough surface on the medial femoral condyle, and then on the after over here, you can see we've smoothed that femoral condyle out, and I've removed the torn and loose pieces from the medial meniscus and cleaned that up.